Cause of disease or cause of morbi. Welcome to Homeopathic Lighter. Today we will going to discuss about cause of a disease. Definition: cause of a disease is a stimulus. It is a stimulus which has the ability to change the inertia of living substance. So it is having cause is anything that precedes the effect. Then what is effect? Effect is an disease. Disease is an effect which may result from recent or remote cause. Then type of cause. Mainly cause is of three types. One is exciting cause, then exciting cause or precipitating cause, fundamental cause, maintaining cause. So what is exciting cause? Let's see. So exciting cause is described in Approach 5 and 73. It is states that the cause which excites a disease. Exciting cause is nothing but it is a cause which excites a disease condition either in form of acute or acute exacerbation of a chronic. That indisposition is the slight alteration in the state of health which manifests one or more trivial symptoms observed by short time previously but not require any medicine act. If the physician refer for the patient to any slight alteration of a diet and a regimen, then this indisposition will be removed. Now what is types? That is individual and collective in human device. So example of individual means a person want to optimum hygienic condition. If not hygienic condition occurs, then the person gets disease. So hygienic condition for the sensitive for that person, for that individual. Excess or insufficient food or sleep or rest becomes restless to that person. If he gets sleep, means changing his sleep without medicine. If we say that you got and take some rest, then you will feel better. This is a individual type of the physical or mental irritation which cause acute exacerbation of a chronic. We discussed before, like asthma. Then example of a collective disease. Mainly two types. One is meteoric or telluric cause, another is acute myasthenia. What is meteoric or telluric cause? Meteoric, climateric or physical substance such as water, soil or climateric disturbance which causes acute disease, that is comes under this meteoric or telluric cause, and these are sometimes of collective exciting cause. Acute myasthenia is a type of collective exciting cause which is unavoidable and due to the climate, warm or induction or famine. Now collective disease is divided into four types. One is physical causes, mechanical causes, nervous or exciting cause, hygienic or exciting cause. We discussed what is physical causes, mechanically we discussed many things. Then nervous and exciting cause, fear, just like acute symptoms. Then hygiene we discussed in the individual type of exciting cause. Now we go to what is the role of exciting cause in the acute disease. Mainly it rolls as a transient explosion of the latent sura. Without exciting cause there is no acute disease. So it explodes the latent sura, and which itself is the acute disease. So exciting cause like overheating, these are the exciting cause. Then exciting cause having a very positive influence on the explosion of acute disease. So it have a positive influence. Okay. Then we shall discuss what is the therapeutic importance of exciting cause. So role of exciting cause in chronic disease we discuss. Now such as in a person suffering from vocal asthma, if he exposure to cold, then asthmatic attack start. So what it means? It is acute exacerbation of a chronic disease. That's why the cold is act as exciting cause, vocal asthma which is a chronic disease, and the things appears as a acute exacerbation of a chronic disease. Now therapeutic importance of a exciting cause. Avoid noxious influence. By knowing the exciting cause, the physician or the patient himself can know that which noxious influence causing this disease. So by knowing the exciting cause, we can avoid the noxious influence. We can cure the indisposition. Indisposition, what is we discuss? Okay, then help the physician to manage the proper food and diet regimen, hygienic diet, proper water supply, sanitation. These things are more important in the acute disease mainly, and so that the ascending cause is important to know. Now we go towards the fundamental cause. Fundamental cause is written in 3 Apogem 73, 78, 79, 80, 204 and 206. So what is the fundamental cause? Fundamental cause is the important which is responsible for formation of a true natural disease. So true natural disease is formed by the fundamental cause. So mainly produce chronic disease and a predispose of acute disease. So what is chronic disease we discuss? What is predispose of acute disease means like acute exams like, but we discuss after that. Mainly it is 3 types of chronic disease, mainly psoriasis, syphilis, psychosis. What is chronic disease? Mainly psoriasis, syphilis, psychosis are 3 types of chronic disease. So chronic miasm are certain period of origin. So chronic disease is due to the chronic miasm. And what is chronic miasm? Chronic miasm is having certain period of origin, period of progress, but no period of declination. So chronic miasm also having a genetic effect, means it is inherited from generation to next generation and only prohibited by anti-miasmatic remedy of homeopathy. So chronic miasm is divided into 2 types. One is venereal, another is non-venereal or simple or complex. But in the venereal part, we include psychosis and syphilis chronic disease, non-venereal psoriasis, whereas in simple there is psoriasis include, and a complex there is psychosis psoriasis, psychosis syphilis. 2 diseases come together. Hahnemann says that psoriasis is the most simple fundamental cause. Okay, and it will produce all other innumerable disease. So miasm is also a type of a fundamental cause. Then now we go, what is the therapeutic importance of a fundamental cause? In order to cure the chronic disease, chronic miasm should be discriminated so that we can require a proper anti-miasmatic treatment we can have. So such as in a person, if every time he gets fever when exposure to cold air, the symptom indicated aconite. If we give aconite at that time, so aconite is a superficial remedy, it is not a deep remedy. So immediately relief occurs. But when the miasm is present before, so when again he exposure to cold air, then again fever appears. So that we should require a similar antipsychotic medicine for permanent cure. So that is the fundamental cause therapeutic importance. We can know from this example. Now this is all about the today's topic. After that we go for the maintaining cause we discuss in next video.